Samira.
Dr. Al.
We worked together at the VA a few years ago, and now you're in R4.
Yes, and I'm so excited you're joining us. Dr. Mel King is here, too. I think you worked with her as well.
I did indeed.
The right, stand by with massive transfusion protocol.
I put 2 units on the infuser.
Sterile blood.
Sorry, that's my phone. And hook up the thoracil.
Want me to get that for you?
Not right now.
Okay, team.
Samira, next steps.
Keep transfusing open the right chest.
That is correct. Exposure.
Convert to a clamshell.
Exactly.
Trauma shears.
Squeeze from the apex to the...
Putting a kink in the garden hose. It'll stop the bleeding.
That could possibly work. Blood loss is slowing down.
That's a good... You are very popular today.
Sorry, I'll turn it off when I can. Hardly any hemorrhage on the right.
Looks like the flip worked.
How's the heart working?
எப்போ முடியுமோ நான் கூப்பிடுறேன் என்னால எப்போ இவ்வளோ தான் பண்ண முடியும் ஆமா சரி bye. My mother is trying to destroy my life.
Well, yeah, they seem to take pleasure in that.
I committed to a partnership track position next year at a hospital back in Jersey so I could be close and support her. But now she's getting married and selling our house to go on a year-long cruise around the world.
Wow. I mean, that's
Pretty fucking stupid idea, if you ask me. She's known this guy less than a year. What if he's a player? What if she disappears at sea?
I mean, what if they're in love?
Lust is more like it.
That is even better. Man, it has been a while, and I'm solo this weekend. I need to get laid. It's a little much before 8 a.m., right?
Yeah. Or ever. Did you eat anything out of the ordinary recently?
No. Sorry, but we went through this a bunch. Don't you people communicate? You're the third nurse we've told her story to.
I'm a doctor. Richard.
Would you go to the cafeteria and get me a large chamomile tea? What can we get you, my dear?
I'm fine. Thank you.
Yeah, I'll be right back.
Please excuse my son. Ever since my husband died, he's been a little overprotective.
I think it's sweet. You're very lucky to have him.
I am.
Are you still taking your loperamide and cholestyramine?
Not so much.
No? That may be why you're experiencing the abdominal pain and vomiting. When did you stop taking your meds?
Last winter or so. My neighbor Helen and I bingo in Wintersville. There's a dispensary next door. And we got some marijuana. And I swear, it cleared everything up. A few cookies every few hours, and no more pain.
A few cookies? How many are you eating in a day?
Oh, I don't know. Probably a dozen or so, but they're not very big.
There have been some studies that show an added dementia risk with marijuana use in older adults.
Oh, that sucks for old people.
But over 28 days, you can follow PCARN or step-by-step to determine risk of invasive bacterial infection.
This baby looks great.
We know nothing about the birth history.
CBC, blood culture, chem panel, chest x-ray, UAN culture, respiratory virus panel, check inflammatory markers, procalcitonin, and CRP. Then take it from there.
That sounds like a plan.
Dr. Robbie, Santos needs you, North 1.
Seems happy enough. Yeah. I just got a quick point of care CBC. The girlfriend hasn't been much.
Have you met Emma? First day, new grad RM?
Hi. Nice to meet you.
Emma needs to learn cast removal.
How long's the cast been on?
Months, maybe years. Probably gonna want to breathe through your mouth. All right, Mr. Digby. Dr. Mohan can cut your cast off now.
How long's the cast been on?
I don't know, but it's really getting itchy.
Okay, this cuts the cast, not the skin. To itch him.
Thank you. Maggots. I'll need ethyl chloride spray to freeze them off.
This is one of my residents, Dr. Mohan.
Nice to meet you.
You as well.
I wish we could recruit as dedicated and talented young women as you two.
I imagine it's a calling, much like medicine.
Yes, very much so.
Sister Grace, under the microscope, we're seeing something called a gram-negative bacteria.
Is that serious?
It can be, if left untreated. Just use it home every few hours.
How did I get it?
So the appearance of the bacteria...
I'm a nun, not a numbskull.
Are you handling?
Yes, part of my day is spent...
I bet we can scrounge up a couple boxes of gloves while you're here. It's important to protect yourself. We'll be back. More labs are back on a normal so far, but you seemed really concerned earlier.
Agreed, but we can avoid the trauma.
Dr. Elishimi?
Dips.
Foster care?
To walk away from you, little one.
We need to call the police?
Do an AccuCheck.
I'm on it. His tachy at 124, pulse ox 97, BP's 106/72.
Lungs need to start treating that, then right to CT to rule out any from the Chem7 and the VBG.
Why is he in DK?
Infection, stroke, myocardial infarction, pancreatitis.
Yeah, we always check for those. They're part of the standard order set. Right? Dr. Mohan?
Meaning?
We can start the insulin drip and add 20 of K to each liter.
Big.
I recently had a case in the ICU.
VBG is back, pH of 6.97.
Normal 7.4.
What caused
Water and electrolytes leading to severe dehydration, cardiac and renal dysfunction.
Insulin drip, fluids with KCl, capillary glucose every hour, Chem7 every 4 hours.
ICU's gonna want a double lumen.
We're just trying to get her upstairs.
Super baby's urine dipped negative, 0 WBCs, respiratory panels positive for rhinovirus,
Feel like they're just trying to keep her down here.
Can you blame them? Never met a peds of crying babies. Does to a person's psyche.
I almost went into peds.
Good thing you didn't trust me too long up there, you cuckoo for Cocoa Puffs.
You are very punchy today. On that note, I'm gonna go check on Louie, and then I'm gonna get some air in the ambulance bay, so if anybody needs me, that's where I'll be.
Lot of caps.
08/72.
EFAS negative. Hell of a lot better than the present.
Intubate.
Maybe, maybe not.
Mr. Yee! Joy, start a rub on his chest like this, really hard, please. Mr. Yee!
Spontaneous eye movement, response to pain, GCS is 10, borderline for intubation. Robbie?
Yep.
Marquis back from CT.
Oh, okay.
No bleeding inside the skull, C-spine, no fracture C.
Logic abnormalities.
Sometimes it doesn't show up on CT, only on MRI.
Dr. Mohan? Are you sure? Okay. Critical potassium level 1.2, BT4.
Team can harm electrical activity in the heart.
Charge.
Clear.
Resuming compressions.
Thumb and forefinger make a C, bottom three fingers make an E for jaw lift. One breath every 5 seconds. Come here. All right.
About 2 minutes since defibrillation.
Holding compressions. Normal sinus.
Carotid, strong carotid. Okay, let's try for BP. 2024 ACLS guidelines. Patients can remain pulseless for a little bit even after successful defib.
He came back with 1 shock.
84/56, heart rate 112.
Free fluid's much bigger than before.
She's not turning the corner. OR's holding a room.
Vitals in the field, no distress. She refused to sign in.
You should have convinced her.
20/20 hindsight, she was stable.
Until she wasn't.
Next time I'll use my X-ray vision goggles.
Let's get her upstairs.
Gotta do an AccuCheck on my DKA patient. Thanks for the backup. Were you able to get a hold of your mom?
Yes, she's on her way. She doesn't have a car. She takes buses, so it takes longer. I'm sorry.
Don't be. Current insulin is 0.1 units per kilo per hour. Next steps?
Because you can normalize the blood sugar before you...
Have to give IV dextrose to keep the blood glucose in between 150.
I'm sorry, what?
It's 10:15. We're actually just getting started.
Oh.
There she is. Dr. Mohan, this is Lori Diaz, Orlando's wife.
Thank you, Perla.
Thank you.
Hi, Mrs. Diaz. Let me take you to your husband.
Ay, mi amor. I'm sorry you have to be here alone.
I missed my first bus transferring. Anyway.
How'd I get here?
You fell at your construction site. A coworker brought you in.
He's a lot better, but doesn't remember anything.
That's common after a concussion or DKA.
DKA?
It's a serious complication of your husband's diabetes.
How serious? Can he go home?
We still have to clear the ketones from his bloodstream. He'll need to be on an insulin drip for a while until things get back to normal. Best if he stays in the hospital.
It's okay, Mom.
Things are headed in the right direction, Mrs. Diaz. He's going to be better.
Sorry, I gotta check his blood sugar.
Oh, do you mind?
Absolutely.
So, the thing is, we don't have health insurance. So, I don't think that we can afford this.
I'll have our case manager, Noel Hastings, come by. She's an expert in health insurance. She might have some options for you for coverage.
Okay, thank you.
Both parents work, but neither of them have health coverage?
Orlando and his wife have multiple part-time jobs that don't offer insurance.
Can they qualify for Medicaid?
Unfortunately, no, because their combined annual income is over the Medicaid threshold for a family of 5.
So they make too much money?
And not enough at the same time. They live over the poverty line, and yet they are still living paycheck to paycheck. I think their best option would be to buy private insurance through the Affordable Care Act.
Thank you.
My parents don't have insurance?
I'm sorry, Anna.
How much will it cost to keep my dad in the hospital?
I don't know. But the ER visit alone will likely be in the thousands. We will figure something out, okay? How are you feeling, Mr. Diaz?
Much better.
We need to talk about how your diabetes progressed to this place. Is this student Dr. Juan? What you say here remains between us.
I'm taking a lower dose of insulin than I should be.
How much of a prescribed dose are you using at a time?
Half. I used to have insurance through work, but I lost that job when the pandemic hit. It was easier to keep up with my medication then. I had a great primary doctor, too. Now I'm kind of on my own.
Do you have a glucose monitor?
Oh, yes. But I can't afford the test strips every week. They're too expensive. Can we not talk about this in front of my family?
For Dad's medical care since we don't have insurance.
No necesito eso. No voy a rogar por dinero.
Ana solo está tratando de ayudar. Setting up a GoFundMe, that's what her generation does. That's how they support each other. Doctor, tell him.
Your wife's right.
Staying here is gonna cost more than we can afford. Look, I'm feeling better. I'll just leave.
Mr. Diaz, even if your blood sugar is back to normal, we have to continue with the insulin drip until we clear the ketones from your bloodstream. Otherwise, you could experience electrolyte disorders, heart and kidney problems.
Mi amor, you're healthy.
I can find her. BRB.
Hang in, Vanco.
You make too much to be eligible for either Penny or the hospital's charity care.
But we can't afford healthcare premiums.
It's unfortunately very common for people to fall between the cracks. It's an imperfect system.
Can PTMC help with the cost in any way?
We can offer financial assistance. We pay 60%, we cover 40%.
Thank you.
You're being thoughtful. I just blew up.
Well, Miss Noel was just telling us that the hospital is gonna give us a big discount.
We can... Yes, unfortunately. It could end up being lower depending...
Right?
Yes.
No,
Excuse me?
I mean, not necessarily. Couldn't we just admit him to med-surg instead of ICU? Wouldn't that be a lot cheaper?
MedSurg won't accept him with an insulin drip.
Usually true, but let me talk to the charge nurse upstairs, and I'll see what she says.
Thank you. Food poisoning holds asking to leave. Wants to take her kids to the water.
Okay, let's get him off the board.
Roll him right side up.
Hey, we're gonna need the cuffs off.
Get Mr. Varney prepped and draped. Dr. Mohan, you're in charge.
Let's identify the landmarks.
Cuffs? Yeah, you can just leave them on.
Do you need to get that? Nope. It's my mom. Ignore that. You can't ignore. But you'll be fine. What's up with you, Whitaker? Trouble in rooming land?
No, not really. I think I overstepped with Dr. Langdon earlier.
Oh.
He was...
Went to rehab. He's working the steps, and hopefully it's all behind him. Place the needle in plane, superficial to the serratus anterior, between it and the latissimus dorsi.
You can see the fluid dissect and diffuse.
Dr. Mohan, we need you. We've got 2 more rigs from Westbridge pulling up right now.
Go. We got this.
Thanks.
I spoke to the charge.
Insulin drip.
They know, and they can change to a SQUID protocol.
Squid?
Sub-Q insulin and DKA.
So no IV drip.
Just shots of short-acting insulin every 4 hours PR. And 5 days on med-surg is gonna cut your hospital bill down by 2/3.
Okay, so what's that gonna cost?
I can't give you an exact amount, but roughly 35,000.
So after about 40%.
We got you, Dad.
Let's give you some private time with your family. Sorry, thank you. Was worried he might bail.
My pleasure. The real thanks goes to the newbie here for thinking outside the box.
Sorry I doubted your med-surg pitch.
Ah, no sweat.
How'd you think of that?
My family had to think of a lot of creative ways to help my uninsured grandma. Leukemia. System doesn't work for you gotta work the system.
She survived?
For a while, till she didn't. She died before my freshman year of college.
Sorry.
Her death taught me a lot. Mainly that I don't want to be around people dying.
What else? Cancer of the oropharynx, esophageal strictures, prior strokes, malabsorption, inflammatory bowel disease, none of which were in his medical record. What about psychosocial causes?
Could be an intentional hunger strike.
Or refusing food to get to the infirmary.
Could also be abuse or neglect. Let's start with a nutrition history once he's...
If he's clear to eat.
As long as it's a liquid diet.
We have the results of your CT scan.
Your jaw should heal without surgery, which is good news, but it will be a few weeks.
Before I can eat?
Solid foods, yes. Or you can have food pureed with liquid in a blender.
I don't have a blender.
Right. Sorry.
We have a calorie-rich supplement drink called Ensure. Comes in chocolate, vanilla, or strawberry.
Tests indicate low levels of protein and vitamins. Can we ask you a few questions about your diet?
How many meals or snacks do you have in a 24-hour period?
How often do you eat cereals, fruits, or vegetables?
Not many fruits and vegetables in prison. Slow and steady.
We're on Eliquis. That shouldn't happen.
Yeah, I know, but
Donnie, I got this. Don't worry, Mr. Francis. I'll order the D-dimer. I'll be back to see you.
Thank you, Dr. Mohan.
You know, I'm an MP now. I can pick up a patient with dyspnea.
I'm sorry. I've seen him before, and he's asked for me.
Why even order the test? He's on Eliquis.
Mr. Francis comes in every month and always asks for a D-dimer. Just, he's worried, and it puts his mind at ease. Why not?
Yeah, okay.
Donnie's the best. You'll learn a lot from him.
That's right.
She took 3 ounces of formula without vomiting or distress.
Excellent. Dr. Wolk from Pitt should be done shortly.
I think I saw her smile.
A true social smile where the baby is awake, alert, and responding to facial expressions usually doesn't happen until 6 weeks or older. It was likely a reflex smile that happens while they're sleeping. But some parents have reported their baby smiled socially as early as 4 weeks.